Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for today's briefing. Joining us today, the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you. Good morning, everyone. Today I am announcing, sadly, another death due to COVID-19. It's a stark reminder of the impact of COVID-19 continues to have on our province and that we need to continue to remain vigilant and follow public health protocols. That's why we moved swiftly to impose restrictions where needed, and most recently at the New Brunswick border. And Dr. Strang will be outlining some new mask protocols in just a moment. We feel these restrictions are necessary to see that Nova Scotians continue to be protected. Throughout Canada, COVID is on the minds of many, as it should be, as well as in this province. But this province also is about to get into a very difficult weekend because of the anniversary of the tragedy at Portapique. And so our thoughts continue to be with the families and friends impacted by such a tragedy. Today, there are 6 new cases of COVID-19, and they're all related to travel, except for one is a close contact. There is an additional UK variant that we're confirming today, and this would have been from a previously reported case. There are 3 Nova Scotians in the hospital and 42 current active cases. Yesterday, I had the opportunity to visit a local pharmacy in my area in Timberley. I was able to see the clinic there, the Guardian, and meet with pharmacists and the owner of the pharmacy to see the operations and the vaccine rollout. They did over 200. And I was there to thank the Nova Scotians that are working really hard to ensure our vaccine gets out to Nova Scotians quickly and reliably. And today, Dr. Strang and I visited the forum and went through the whole process from beginning to end, from the greeters to the security people, all the way through to those administering the vaccine. It was a very positive experience, and I again want to thank all those that were involved, that continue to be involved on the front lines. We saw Corey Watt was an individual there that had her vaccine administered, and Dr. Strang and I chatted with her. She said she didn't feel a thing, and it was a very positive experience for her. These Nova Scotians are doing extraordinary work. This is monumental for our history in our province. We will reach 200,000 doses at some point today. As of yesterday, we had 19.6% of Nova Scotians receiving their first dose. And we're well ahead of the national average for those that are receiving, that have received their second dose. On Wednesday, we administered over 13,000 doses of the vaccine, which is a record. This week, we're set to administer over 54,000 of vaccine. Several weeks ago, Dr. Strang said the maximum capacity the clinics were working towards was 12,000 and 86,000 per week. We're well on our way and actually doing more than we expected at this point in the rollout. We're well positioned to deliver whatever vaccine supply we get from the federal government. And supply continues to fluctuate, but our system is designed to ramp up with more shipments coming. 96% of our healthcare workers have received their first dose. So now the healthcare worker clinics can start winding down, and those immunizers can support community clinics, which will help increase our ability to get doses into arms. Early in the rollout, we target our most vulnerable citizens to be vaccinated based on the need to maintain the health system and risk factors, especially age. These groups have either been vaccinated or are being scheduled to be vaccinated. This includes healthcare workers, licensed long-term care homes, and Nova Scotians over 80. We held outreach clinics for people and elders age 55 and older in African Nova Scotian communities and the 13 First Nation communities. We have built a vaccine program that is flexible, reliable, and equitable, and on track. I want to highlight some key successes of our rollout. We said we'd ramp up number of doses getting into arms as our supply increases, and we have done that. We said we'd increase our capacity to get vaccine into arms across the provinces, bringing more and more locations online, and that is happening. We said we'd systematically go through the age groups, and that's happening ahead of schedule. We said we'd distribute vaccine equitably across the province to ensure a provincial level of population immunity, which is the goal, and that's happening. We said we'd support those most vulnerable first, at most risk of severe outcomes from COVID. And by focusing on age and working with communities more susceptible, we've done that. This is a province-wide effort, and each step of the way, we've had the incredible fortune of working with public health on the front lines, and of course, Dr. Strang and his dedicated team. We knew that if we followed the science, we could rely on Nova Scotians to follow the guidelines and work hard to get to where we are today. And I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everybody. I just want to thank yet again Maritime Tartan for my matching tie and mask today. They've actually produced this as a cancer fundraiser. Their funds are for the Canadian Cancer Society, but it has words of hope and inspiration and strength on the pattern. And I thought that was very appropriate, both to celebrate this morning at the vaccine clinic, but also the weekend coming up, where we are reaching back to a year ago. A very challenging time, and those words of inspiration and hope are appropriate for this weekend as well. So thank you to Maritime Tartan. I would also like to express my sympathies to the family of the person, the most recent person that we've lost to COVID-19. With the Portapeak anniversary, this is a difficult time for all Nova Scotians, and we mourn with everyone who lost loved ones over the past year. This death serves as a reminder for the need for continued vigilance to prevent COVID-19 from coming into Nova Scotia and spreading here. That is why we reestablished the 14-day quarantine for anyone entering Nova Scotia from New Brunswick as of 8 a.m. yesterday. And I know this is disappointing for people who were hoping that the Atlantic bubble was going to proceed, but putting a pause on that is the right decision for right now. We are keeping a close eye on our collective situations in all 4 Atlantic provinces, and we'll reevaluate as we get closer to the new proposed date to open up the Atlantic bubble. The border controls and accommodations for people who cross the New Brunswick-Nova Scotia border on a regular, even daily basis for work or school that were in place in the past are now in place again. So this includes crossing the border for child custody, for school, for work purposes. People who must make a necessary quick trip between Nova Scotia and New Brunswick to drop off or pick up people, including university students or picking up other things or goods, are exempt from the requirement to the quarantine, but they must take precautions that are outlined in our travel protocols. All this is on our coronavirus website. Another change we are making to help prevent the virus from spreading is expanding our mask requirements. This is due to the now common variant strains and their much greater ability to be transmitted between one person and another. Effective immediately, masks are now required when you're in a restaurant or bar, whether it's indoors or on the patio. So regardless whether it's indoors or outdoors, masking is required when you're entering or exiting, getting up and going to the washroom. Of course, once you're seated and you're actively eating or drinking, you can take the mask off. Masks are also now required in outdoor public places where it is difficult to maintain physical distance. So this includes places like farm markets and special events such as festivals. Nova Scotians have been very good about wearing their masks to help protect everyone, and I know I can count on you to continue in these outdoor places. Turning now to vaccine, I had the opportunity to visit the Halifax Forum Clinic today with the Premier, and had the pleasure of meeting Ms. Watt and with talking with staff at the clinic and seeing how efficiently these clinics are running. And it was such a positive environment, so full of so many dedicated people and full of such hope. And I want to provide my sincere thanks to all the staff and volunteers that are running clinics across the province. You're providing a critically important service to Nova Scotians. And I look forward to seeing people at the Halifax Forum Clinic next Tuesday, when I will be getting vaccinated as one of the healthcare workers. As the Premier has said, our vaccine plan is on track. I'm confident that Nova Scotians who are able to get the vaccine and want it will have an opportunity to get their first dose by mid to late June. Then the work to get everyone their second dose will begin. While we will have a good level of population immunity after everyone has their first dose, we won't see the full benefit and full long-lasting immunity until everyone has a second dose. This week, we've been able to finalize some substantive changes to the appointment booking platforms. The online booking site now has an address an address lookup tool that identifies locations close to somebody's home address or whatever address they enter, and that will tell them which clinics have available appointments and for which type of vaccine. We've also added capacity to our phone line. There are both more lines and operators. Just this week, we expanded from 50 to 100 lines. That means 100 callers can queue while they wait for an operator. And within this queue, a feature has been added to inform callers of their estimated wait time. If callers exceed the 100-caller queue, a message will advise those callers that the queue is full and to call back later. And once the call number of calls exceed 120, anybody else calling in will get a busy signal. And next week, we're doubling the number of staff answering the phone lines. And we anticipate that all these improvements will make the booking process even more, move even more quickly and have a better, less frustrating experience for people. And I also want to talk a little bit about our vaccine supply. And while our capacity to deliver vaccine has increased rapidly and even more quickly than even we expected, the supply does remain limited and somewhat unpredictable. A week ago today, we found out that expected shipments of Moderna and AstraZeneca vaccine were going to be delayed. Thankfully, we had not released appointments for these shipments. If we had, we would have been in the same position as some other provinces who've had to cancel thousands of appointments. So until we are more confident in the ongoing supply from the federal government, we will continue to release appointments only when shipments are confirmed. It's important to us, and we believe Nova Scotians, that they can rely on our vaccine plan and know that when they book an appointment, there is vaccine waiting to go in their arm. In closing today, I want to thank Nova Scotians for their continued patience. So many of you are eager to get vaccinated, and as Chief Medical Officer of Health, that is tremendously encouraging to me, and it gives me lots of hope about our way out of COVID-19 here in Nova Scotia. And I hope the interest in people getting vaccinated continues, and that we continue to see this strong uptake across all age groups. The situation in other provinces is very concerning and may well be making you anxious. I know it's making me anxious, and it's absolutely normal that situation as we're watching it creates that anxiety. But it helps with anxiety if we know if there's something we can do about it. So while we continue to roll out our vaccine program, Nova Scotians need to continue to follow public health protocols, limit our social activity, socialize with consistent small groups, stay home if we're unwell, follow physical distancing, hand washing, and masking rules. And we have to continue to live with significant public health restrictions. I know that a COVID-free future may seem out of reach, but there will come a time that we can stop wearing masks and hug again. But to get there, we all need to do our part. We need to keep each other safe and get the vaccine when it's our turn. Have a good weekend. Tina.
Thanks, Dr. Strang. Just a reminder, we'll take one question, one follow-up from reporters both in the room and on the phone in the allotted time that we have for today's briefing. We'll start with Alicia Drouse from Global. Go ahead, Alicia.
Thank you. This question might be for both the Premier and Dr. Strang, but the Canadian Medical Association is calling for the federal government to change the vaccine distribution so that it focuses more on areas that are harder hit by COVID right now. So, for instance, Ontario. So is there any consideration, or are we at risk of losing our supply here in Nova Scotia to help provinces like Ontario where things are a little bit worse?
We don't have any indication that that's going to take place. We expect to get the volume as we have committed to us. It's important that we continue to follow public health guidelines as we wait for our vaccine, but things can change really quickly in any province, and so I think it's incumbent on us to make sure that we say to the federal government that we expect to get our vaccine. And Dr. Strang, you probably have some.
Yeah, and I can add that that's never, all our conversations at my level with our federal counterparts has always been that we can expect to get our per capita allotment. Vaccine is only one component. There's other ways that Ontario might reach out for help. There's a formal process that was established during H1N1. There's a memorandum of agreement or mutual aid. There have been no requests come to Nova Scotia through that formal agreement at this time.
Go ahead, Alicia, with your follow-up.
And I know that you did say that Moderna supply that we're supposed to get is delayed. Is that because Moderna is kind of slowing or doesn't have as much production as they expected and they're not delivering as much to Canada? And is that further going to impact our rollout here?
Two things. Our understanding is that that's on the production side, so delays in their production, so impacting the amount of the full volume of vaccine over the next few weeks from the Moderna plant. We've always said that we have a flexible program that we can adjust up or down as necessary. So we're in the process of now that this has been confirmed, adjusting of how our vaccine rollout for the next few weeks to accommodate this decreased supply of Moderna.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. I'd like to follow on the CMA requests from today. I understand that no official requests have been made yet, but Premier, I'd like to understand a little bit more about your stance on your willingness to share in this way if medical supplies or vaccines were required by an area in Canada that really was struggling with ICU capacity. What is your willingness there?
Well, when I talked to Dr. Strang, it looks like there is a myriad of different tools that provinces can use, the tools that we use very early on to suppress the spread of COVID-19, so we would expect other provinces to do that as well. If we were to redirect a proportion of our vaccines, that would be a drop in the bucket for a province the size of Ontario or others. If there are some other supplies or resources that they require, I think we'd be more flexible in that, and I think Nova Scotians would actually volunteer to step up to help. We don't have an official ask of any type right now, but the volume of vaccines that were distributed, that we're committed to, is what we expect to get in this province.
Go ahead, Lindsay, with your follow-up.
Thank you. I'm wondering, Dr. Strang, at what point will the province be reporting that cases are presumptive variants with the public announcement of those cases? I understand so far we hear about a case being variant a little bit after it's already been identified, sometimes even after it's been resolved.
Yeah, but we can only report when we get confirmation from the national lab. We now have a process where we're doing a screening test here at our lab, but that screening only identifies if a component of the genome is one of the variant strains. It doesn't tell us which variant. So we can't tell you whether it's the B117 or whatever. That has to wait. So we can only talk about that publicly once we get that confirmation. But the reality is, and I was asked this question on Tuesday, and my answer is going to change a bit. That when Tuesday I said, well, we're still seeing some strains that are non-variant. In the last 2 to 3 days, virtually all our samples now are screening in for the variant. So it's almost like the variant is no longer just the variant. That's our norm across the country, that we can expect that everything we detect is a variant. It doesn't change how we respond in public health. In fact, what it means is we have to start to strengthen some of our measures like we did today around masking, knowing that the likelihood of any virus out there is one of these variant strains. That's just how this is evolving, and so we have to accommodate stronger measures because of the increased risk of transmission. But the way we follow up any individual case doesn't depend on whether it's a variant strain or not. And we now think about accommodating restrictions and other things. We just assume that we're having variant strains. It's part of our norm. We're not going to, because we don't, all we can do is say it's a presumption. We don't know which strain it is until we get the confirmation from the lab. But we'll report that when we get it. But what I'm saying is now moving forward, we can anticipate that any case that today we announced 6 new cases. It'll probably be that all of them are going to come back variant strains. So we'll continue to report that. But in some ways, it doesn't matter. We were adjusting our public health response around, it doesn't change what we do around individual cases, and we are continuing to shift our collective public health measures always now that we're in this, where variants are the norm. So we have to be in this, think about how do we better accommodate and protect ourselves against the likelihood that any virus, COVID virus that's out there right now, is more transmissible than it was a year ago.
We'll go to Blair Rhodes now from CBC. Go ahead, Blair.
Dr. Strang, I'd like to follow up on what you just said. Why is it that we're seeing a fair bit of community spread in other provinces, but we don't seem to be seeing the same thing here, given that, as you're saying, most of the new cases that you've identified are of these supposedly more highly contagious variants?
I think it's twofold. That the cases we're seeing almost virtually, they're all in travelers who are all under quarantine, or when they do have close contacts, there are people who are quarantining like in a household with that case. And they're allowed to do that. If they choose that, then the whole household is in quarantine. So it shows that our border measures are working. We're detecting lots of cases, but they're in quarantining like they need to be, and that quarantine is stopping them exposing people out in the public, other Nova Scotians. And in the few circumstances where we have had public exposure, that we can't fully explain it, but I firmly believe that because we have continued strong measures limiting social activity, those kind of restrictions that we have had for months. Also, that we have the vast majority of Nova Scotians are doing what they're asking them to do, masking, maintaining physical distance. That all our adherence to the public health restrictions and the public health measures, even if there is a virus strain that gets, or a virus that gets out in the community, that's helping minimize the spread. The message to Nova Scotians should be that we are doing the right things, border measures and everybody following public health protocols and restrictions. That's what keeps us safe, but we have to stay fully committed to doing that, because that's what we need, that to keep us safe for the next number of weeks until we get high levels of protection from the vaccine.
Go ahead, Blair, with your follow-up.
On the question of what can be offered in the way of help to other provinces that are having a worse time, but looking specifically at the fact that ICU beds in other provinces are at or near capacity, is it even feasible to consider whether Nova Scotia could accept patient transfers from some of these harder hit areas, given that our hospitals seem to have, at least theoretically, the room right now?
Well, I'm not sure we have. I mean, that's really a detailed question for the health authority to answer, but certainly in my discussions within the department, our health system is full. The Halifax Infirmary is at full capacity because of our good epidemiology, we've been able to open up all the other aspects of healthcare to Nova Scotians. So we'd have to look at individual requests, and we would, I think it's fair to say, we would do what we could do to accommodate, whether it's supporting staff going to another province or accepting patients, but knowing that there's limited capacity for us to do that. But that, we'd have to wait till we got a specific request and then work that through our health system here.
Next, we'll go to Tim Bousquet from the Halifax Examiner.
Dr. Strang, most of the questions I had have already been asked, but what is the percentage take-up on the vaccine for the older groups? It seems like I'm hearing that a lot of people over 65 or over 60 are not signing up for. And also, weren't we supposed to have the next age cohort announced about right now? So where does that stand?
So we don't have all the, because once we open up to an age group, we never close it. So we still don't have the final data on like the 80 plus, because there's still people who are 80 plus getting immunized. Well, I can give you an example though. So we opened up to the 65 to 69 year olds. There's 66,000 people in that cohort. 44,000 appointments from that age cohort have been booked. That many of them will be the next week or two. So we continue to get good uptake as we open up each cohort, and then we'll still continue to roll through that. They never become ineligible. To your second question, we're looking at, and we'll have some news fairly soon about when we can go to the next age cohort. When we did open up to the 65 to 69s, we did say that because of the size of that cohort, we needed to give it a bit more time before we could open up to the 60 to 64-year-olds.
Go ahead.
Specific to the AstraZeneca, it appears that Ontario is having difficult pickup on people getting the AstraZeneca shot. Is that the experience here, or do you have numbers on that?
And we've certainly, initially, we had very good uptake, and most of our appointments for AstraZeneca were taken quickly, but we certainly have seen a significant decrease in the uptake for the remaining amounts of AstraZeneca in the last little bit. So, and in my national conversations, every province is having the same, they're feeling or seeing the same impact. All the discussions and the concerns around the rare but serious side effect with AstraZeneca are creating a decreased demand for AstraZeneca vaccine across the country.
We'll go to the phone lines now. We'll take our first question from Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Dr. Strang, I'm just wondering if you could expand a bit more on the new mask policies. Why make this change now?
Well, this is really, as I said, it's about the growing concern around variants. We've always said, even when back in July, when we said we made masks mandatory in indoor public places, we've always said along with that, we encourage Nova Scotians, even when they were outdoors in places where they couldn't be certain of maintaining physical distance, we were recommending and encouraging people to continue to wear a mask. We're now just making in some of those outdoor areas where physical distancing cannot be reliably maintained, we're now making the wearing of masks mandatory. And that's simply because of two things. We're now moving into the seasons where patios and restaurants are opening up, and we need to be clear what the rules of masking are on patios versus the indoor part of the restaurant. But also because of the variant, the increasing amount of variant and the increasing knowledge about how more transmissible the variant strains are, that we felt it was appropriate to strengthen the outdoor wearing of masking in places where people could be in close contact with each other.
Go ahead, Natasha, with your follow-up question.
Thank you. Are you giving any more thought to potentially requiring a 3-layer mask at this point, or are we still fine with a 2-layer mask, even if the variant is more transmissible?
So we continue to look at this at a national level. The recommendation from the Public Health Agency of Canada, who are the lead on this, is that while 3 masks are preferable, we're not mandating that. No province is, or nor is the federal government saying that you have to have a 3-layer mask. So we're certainly encouraging that. But I always come back to that the 2-layer masks give good protection. But one of the most important things around masking is not whether it's a 2 or 3-layer mask, but are you wearing the mask consistently where you're supposed to, and are you wearing it properly? I still continue to see far too many people not understanding that their nose is connected to the back of their throat, and that somehow they don't need to wear a mask over their throat or a mask over their nose. So, and other ways that masking is not being done properly.
Next, we'll go to Michael Tutton from Canadian Press. Go ahead, Mike.
Yes, Dr. Strang, there was one person brought ashore yesterday from the oil tanker, the STI San Telmo. Can you give us an update on how many cases are coming ashore and whether there's any changes there?
So I'm aware. I wasn't aware of somebody yesterday. I was aware that initially on the weekend there was one person who was brought ashore for assessment at hospital and then was within 24 hours released from hospital. As far as I'm aware from yesterday, the rest of the crew remains on board, and they've all been tested. They're all being monitored. EHS has been out to test them, and they were left with portable oxygen saturation monitors. And they're in constant communication with our federal colleagues. These people are under federal jurisdiction, but they're being monitored closely. And the province, we're on standby to help assist if any of them require further health care. We'll certainly assist in getting them off the boat on shore with appropriate protocols to receive the medical attention they require.
Go ahead with your follow-up, Mike.
Premier, your comment on drop in the bucket in Ontario would just be a drop in the bucket. True, it would be small, but if it would save lives in exchange for some people waiting longer, what do you make of that argument?
Well, again, there are other tools that can be used. Nova Scotians earlier on stayed home. There are other restrictions that can be put in place. The vaccine rollout is to get to population immunity, which is our objective as well. And so we have to keep our minds on variants that can come into this province very quickly, and we need to stay on track with our vaccine rollout. So We'll step up and help in other ways, but the volume that's been committed to our province is what we expect.
Next, we'll go.
Yeah,
Oh,
Dr.
go ahead,
Strang,
Dr.
go ahead.
Yeah, so I mean, this has come up before. I mean, the analogies is used, and it's actually a good one. It's around let's say you're fighting a house fire. A vaccine is actually not the equivalent of a fire hose. A vaccine is not what gets the house fire under control. You use all your other public health measures. The vaccine is more like building fire safety in every house on the street. So actually, from my thinking, it actually doesn't make sense to reallocate vaccine, because what that would do is put other parts of the country at risk with this substantive risk of the variant to use a vaccine in a use that what it's not intended for. The other provinces need to use other public health measures, and all of us have the ability to vaccinate our population over time to build that layer of the equivalent of the fire safety for every house on the block.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, staff at care facilities in parts of the province have posted on social media upset that they've been dropped off the list for early vaccination. You mentioned at the previous briefing that some job categories, such as rotational workers, would be put into the general vaccination rollout as opposed to being singled out in phase 2. Can you tell me who else has been dropped from the list?
And I'm aware these are staff who are working at programs and workshops for and care homes, very small option homes for adults with disabilities. They were never on the list, on the so-called phase 2 list. On that list, we had 3 specific groups. We had rotational workers, long-distance truck drivers, and then individuals who worked at food processing plants. And we've talked about how they're now going to go through their age-based program. What we're doing as part of our outreach to ensure accessibility for adults who have a range of disabilities, we're going to work with either the work programs or their small option homes or their day programs where they are at to provide them vaccination. And this is about increasing access to vaccination for people with substantive challenges because of their disabilities. The workers in all those locations can get immunized as their age cohort comes up, and they will be able to get faster access to vaccine if they follow that, rather than us trying to build a program to immunize them. Because you have to, as we go to each of these facilities, we want to focus on the adults with the disabilities to immunize them, and then move that capacity to the next facility. If we try to do all the workers in that, it actually slows things down substantially, and then what we're doing is greatly delaying the opportunity for an adult with a disability to get a vaccine, when the healthy worker can very easily go to their age-based program and will actually get vaccinated faster through that process.
Go ahead, John, with your follow-up.
Thanks. This is also for Dr. Strang. Regarding the out-of-province Nova Scotians who have tested positive for the UK variant, there were 3 reported yesterday. Will there be any special procedures for handling them if and when they return to the province?
No, I mean, they would not be traveling until they're considered resolved. So yeah, we've had, I know those cases you're talking about. There are 3 workers who were Nova Scotians who work in another part of the country, were tested in that province. Under public health rules, they wouldn't be allowed to travel until they're considered resolved, no longer infectious. So we wouldn't have to have any special protocols for them once they're able to travel back.
Next, we'll go to Victoria Walton from the Coast. Go ahead, Victoria.
Thanks. Dr. Strang, this question is about long-term care, and coming up, I know, on the anniversary of all of the deaths that occurred at Northwood. I'm wondering if long-term care workers, if it's still allowed in the province for them to work at multiple different locations, say either of the same facility or different facilities entirely, to make ends meet. I know it's been, disallowed in several other provinces during the pandemic.
So we haven't put restrictions on that. Other than if there's an outbreak in a facility, then we say that we have to, those people can't go work elsewhere. It's certainly preferred that individuals work in one facility, but if you restrict it, you create substantive challenges for the individuals, because many of them work in multiple places because that's how they put together a full-time job to support their family. But also by restricting people to one location, you create a substantive staffing challenge in the ability to provide the necessary care for residents in all facilities. So recognizing that, and then there's that continuing care branch that's not part of my work directly, but I work with them, are always looking at this and ways to minimize this. But it's a reality of our current environment in long-term care. And if you were restrictive, you'd create a number of other substantive problems.
Go ahead with your follow-up, Victoria.
Thanks. And another question about long-term care. Is there asymptomatic testing happening right now, either residents or staff at long-term care facilities, specifically Northwood?
Yeah, we're supporting a number of long-term care facilities that we haven't mandated, but all long-term care facilities are able to provide, and we'll help them with kind of train the trainer model, train their staff, and doing regular testing, not on a daily basis, but regular testing for staff in their facilities.
Next, we'll go to Maurice Reese from the Shoreline Journal. Maurice, are you there?
I'm here.
Go ahead.
This is for Premier. What, with the border from New Brunswick closed, what may have to happen, or if it happens, that the closure would continue, say, into June or beyond?
Well, that would be a discussion with public health, and if we see some of the cases that have escalated in New Brunswick start to descend down, then we'll have a look at that. We put the border restrictions on, especially because they were coming closer to our border. That has been alleviated somewhat, but we need to continue to take a cautious approach here, given what's happening. There's still an uptick in Edmonton area, so we'll be very cautious when we look at that potential. May 3rd is the earliest opportunity for the actual bubble discussion, and we'll continue to have those conversations and take that cautious approach.
Go ahead, Maurice, if you have a follow-up question.
Not so much a question, but just wanted to mention that I got my arm punctured yesterday and wouldn't even know that it happened, and it was done up in Shubenacadie, so appreciate the service in the rural areas.
Well, I'm glad to hear that, and thank you for being one of the many Nova Scotians to come out and get vaccinated.
Next, we'll go to Steve McKinley from the Toronto Star. Go ahead, Steve.
Hi, yes. Hi, Premier. Hi, Dr. Strang. I'm going back to the CMA statement. Most of my questions on that have been answered already, but there's just this. We've said that we don't really have the capacity to import patients. You said that Nova Scotia Health is working pretty close to full capacity. What kind of situation would we be in if we were asked to export human resources, doctors, ICU doctors, and nurses? Are we capable of doing that?
I mean, again, the details on that, we'd have to have a specific request, and that would be worked through by the Nova Scotia Health Authority and the IWK to see what was possible, and also were there people willing to do that.
Go ahead, Steve, with your follow-up.
I don't really have a follow-up on that. Thank you so much.
Great, thanks, and that's all the time we have for questions. Go ahead, Premier.
Thank you, and I just wanted to reiterate how important it is to follow restrictions in our province. That's how we are where we are today. We continue to keep our cases low in the single digits. If we continue to do that, I will remain optimistic that we can prevent the type of wave that you're seeing in other provinces. Continue to be cautiously optimistic, especially when I travel to clinics to thank those Nova Scotians that are working hard in our pharmacies, in our community clinics, in Preston and Upper Hammonds Plains. I've been talking to people that are getting out there and getting vaccines, and we all must do our part to get vaccinated, so book your appointment when it's time for you online or at the toll-free number. To all those Nova Scotians stepping up to get their vaccine, I want to thank you very much. It will be a difficult weekend for many of us. So let's be kind to each other, and please think of those who have suffered this year, especially with the tragedy that occurred at Portapique 1 year ago. Thank you.